And are you?
Everyone's coming in right now. Hi, everyone. I'm going to give you a minute. We're just waiting for everyone to get in. Hello, everyone. Welcome back to our final session for the CPH Review Session Series. My name's Ashley Mueller, and I'm the Manager of Educational Programs at NBPHE. As I said, this is our last session, so I'll be continuing to monitor chat and Q&A throughout the presentation. So continue to interact with your fellow attendees, and our presenter will answer any questions at the end of his presentation. This is our last chance to win the raffle for the APHA study guide. So somebody who's here today live at the session is going to win, and you are automatically entered as just from being here. So today's topic is law and ethics presented by Richard Peyton. Rich is a public health professional focusing on literacy, racial/ethnic health disparities, and the LGBTGNC health needs. Rich came to public health after serving 10 years supporting the military and federal government. Aside from his work in public health, he is an adjunct at Malcolm X College in Chicago. His education includes a bachelor's degree from George Mason University and master's of public health from the University of Illinois at Chicago, with concentrations in maternal and global health. Additionally, he holds a certified in public health credential. Rich is a board member of the One Roof Chicago and works as a public health consultant focusing on QTBI POC equity. Rich has published and presented nationally on adolescent violence, sexual harassment, bullying, and risk reduction in vulnerable communities. So with that, I'd like to turn it over to Rich. Rich, we can't hear you.
Yeah. Hi everyone. I was just testing you all since this is our last one to make sure that someone says that they can't be heard. So now that that's done and over with, I'm sure we'll be fine. Really great to see everyone. I am very, very happy to be here. Again, my name is Rich, and I am going to be presenting today on law and ethics. All right. Okay. Perfect. All right. So, as you all have heard probably up to 10 times already, if not close to it, um, these are the domains for the CPH exam. Today, we're going to be focusing on law and ethics, which are 10% of the overall process. So, law and ethics, excuse me, it counts for 10% of the exam, and the domain really just talks about the concepts and scope of ethical and legal principles and how it applies to the practice, research, and policy. It also considers management of conflicts of interest, concerns for health disparities, social justice, and human rights. So we're going to hit on a few of these different things as we move throughout the presentation. But we're really going to be focusing on getting you to think like you're in exam mode, right? So as you're going through this, I want you to be thinking about, okay, what can be something that maybe a question that can be asked about this? What could be some distractors? What could be, what's related here? So I know if I need to do some differentiations. And we'll see that a little bit as we go through a little bit more. Right. Okay. So what this domain is really about, and I'm not going to read every word on every slide, but I will do it a few times because I think it's super important to get this stuff early on. So it's going to be about identifying regulations around policy, security, confidentiality. So when you're thinking of things like PHI, HIPAA, it's going to be designing strategies to ensure implementation of laws and regulations, applying these very basic principles of ethical analysis to issues of public health, research, policy, practice, ensuring the application of these principles. You're going to be taught how to potentially manage, well, not taught how, but shown the resources on how to potentially manage any kind of conflicts of interest that are coming up, to abide by and understand and advise on other laws that are public health laws, because we will see today that sometimes things can get a little bit muddled in this area, right? So we want to make sure we're really able to continue to do so appropriately. And then we're going to be applying social justice and human rights principles when we're addressing community needs. And the reason for that is that's going to be a basis across the board, right? We should always be looking at ways to apply public health practice in an equitable way. All right, so what is public health law? Public health law addresses the government's powers and duty to protect the public's health and the limitations on the power. So this is super important because it's not just about, hey, the public health can make a law about anything. And this has obviously gotten into a lot of people's minds recently around things like COVID-19, the vaccine surrounding that, but also even more recently with things like MPOX, and how we are delineating who does what, how we're picking who goes when, and things of that nature. And so when we think about it, what we want to do is we see it as broken down three ways, right? This shouldn't be too foreign. If you are not someone that is here in the US, either operating or working, the majority of the test is meant to not be very US centric, but some of this is going to be a little bit more US centric. So we do break it down three ways, right? Federal, state, and local. And if you are in a lot of bigger places, you will see this by looking at your health department. You'll have federal departments. You'll have your New York State Health Department. You'll have your New York City. We have IDPH. We have our Illinois Department of Public Health, and then we also have CDPH. We actually have Cook County as well. So we have lots of different things involved. But you're going to be going across these three different jurisdictions when we're talking about who's making laws for what. And then these powers come from the Constitution, right? So the Constitution doesn't necessarily ever say public health or the health of the public specifically, but it does give powers to the government to protect community health, right? It allows the powers that are there can promote and provide for the general welfare. And we know that from our definitions of what public health is, that is included in that. They can tax, they can spend, so they can tax on things, and they can use that tax money that's coming in, that revenue, to turn it around and use it to support different projects and different programs. And that is how money often kind of filters now. So there is things in the Constitution, although it may not say the government has a right to mandate a vaccine, it's going to be done a little differently. As you see, these are things that are going to be things you want to think about and know the difference of when it comes to the test, because the test is going to ask you questions along this: who has the power to promote and provide for general welfare, right? Is it a state? Is it a state power? Is it a local power? Is it a federal power? These are things that are going to be good questions on the exam, on the certification test, to kind of follow through, right? So, and how this really works in different jurisdictions. I'm sorry, there's supposed to be a title on this page that's not showing. But the way this works in items that we can think about the drinking aids versus construction funds. So the federal government can go for a uniform approach across all the states, even though the states have their own ability to have their own autonomy. There are certain things that are going to go against the public good and going to affect everyone else in the nation. And so Congress can make laws around that. And an example of that is instituting a federal drinking age. And what they did, they said, we recommend that the states follow the same drinking age. And they don't have to, and for a long time they didn't. But what the federal government did to kind of play with the purse strings is they tied the state's drinking age to construction funds. So if they wanted federal funds to help with road construction, things of that nature, you weren't getting that from the federal government unless your drinking age was around the same there. All right. And again, the Q&A and the chat are there, so please feel free to use those as questions pop up. I believe Ashley's going to be watching the chat, and so if you have any questions as I'm going, or if I'm going too fast or too slow, please feel free to stop and let me know. Okay, so what is a law? The difference in laws and regulations. Again, this is something that's going to be on the test numerous times, probably in different ways, because it is a key function or something that's very important for you to understand and know. So laws are the legislation. The law is what is going to say this document or this law, this legislation is going to somehow protect or promote health, right? That's what it's for. So it's going to be done by Congress. Going to write up a law. In our amazing Congress that works so well now, it'll probably be bipartisan. They're going to say we're going to solve all the health issues across the country, and that goes in, and that's how the law is done. And then what happens is the executive branch actually institutes the programs that actually goes out and does this. So where the legislation branch is going to be writing the laws, it's going to be executive branch is going to be putting in the policies, the implementation, the regulations that are going to be used as a set of rules to go forth to follow whatever the law is. So as an example, and we're going to use HIPAA here for an example, the law is HIPAA, the Health Insurance Portability and Accountability Act, a law through Congress. There's laws like ACA, right? And then the regulation is going to be the HIPAA privacy rule or the HIPAA security rule, right? And that's what the executive branch is going in through the Department of Health and Human Services as a way to implement the law of HIPAA. All right. Okay. So this should say, again, I apologize because I'll make sure this gets fixed before it gets to you, but it should say protected health information. And what protected health information is going to be anything that's going to give an identifiable information on you. And so this is something that if you're working in research, if you're working in administration, these are things you may see all the time, but you may not think of it in this context. But it's going to be anything that's going to be identifiable. And it can be something as simple as if you're working in a clinic and there's a small Kenyan diaspora and there's 50 people there. And so there are certain things about that group that you may want to think about publishing or writing on. But if you use certain characteristics, it can be too identifying, right? You can say, if I have talk about a certain language, that can be too identifiable. So those are things you do not want to put out. Information you don't want to put out is protected. And this applies across the board, right? So all healthcare providers, healthcare plans, anyone that's going to be dealing with this information. Now, there is no restriction on the use or disclosure of de-identified health information. What that's saying is that as long as you have fully de-identified, it's fine. That's why you'll often see if you're looking at electronic health records or if you're looking at data to do some secondary analysis on, it'll often have a identifier that is unique. Sometimes, to our own annoyance, sometimes there'll be a patient identifier for the hospital, then another unique identifier for the study, right? So that way there is no way to get those things connected. And that is the proper way to do that. All right. So talking a little bit more as we're breaking this kind of process down and we're stepping it down, it's important for you to understand these terms and what they each mean and how they apply. So privacy is going to be the freedom to control, have control over one's information, the freedom from intrusion. So it's saying, I have privacy rights, so you can't come in and look at my private things, or you can't ask certain prying questions without a certain amount of reason or without, approval accordingly. Security is going to be the practice, policies, and procedures that are there to create or to protect something. So in this case, PHI, you have a sign-in sheet from a meeting. These are some of the things that may be overlooked when you look at community level events. A sign-in sheet may be PHI, right? So those are things you want to make sure that you are physically covering and keeping under control. Confidentiality is just ensuring that you don't disclose information to those that don't have access to it. It's a need-to-know basis. If someone has access to it, if someone needs to see it, that's fine. But it's not just a general oh, I have access, so I should look at this. No, it's do you have an actual work need to do that? Um, and then there is sometimes you are allowed to do some disclosures, excuse me, for from confidentiality, such as your mandatory reporter. So if you need to report things like self-harm or potential self-harm or potential harm to others, those are the exceptions to the rule here, where you are allowed to disclose certain, and even still limited certain health information. The title of the last slide was public health, or I'm sorry, was PHI, personal health information. Sorry, I apologize. I'm seeing it and it's not coming out. Personal health information. Right. Okay. So, and when we talk more about HIPAA, right? Um, what it is, it's very specific, right? So we know that there's a specific reason, specific rule around it, and this is actually referring to, excuse me, the HIPAA privacy rule. It specifies when and which covered entities can use and disclose PHI, right? It includes very specific information on that. It also talks about what state laws specify situations in which health practitioners are required to report certain conditions, right? So this is something that they have tried to make it very explicit, very clear, very black and white. PHI is simple. If it's something that's personally identifiable, it has to be protected. Very few exceptions where it can't. And that's important to know. And then the security rule is going to be, again, the HIPAA security rule is just another process, another way of actually implementing that process. Now, with the exception of mandatory reporting, there is a public health exception to this that is important to understand, because there is going to be certain limited reporting that we have to report up through health departments for specific diseases, but that is a very specific exception for certain public health conditions that are reportable diseases. All right. So we're going to transition from HIPAA. That was a lot. I know a lot of us are probably either dealing with HIPAA all the time or maybe not dealing with it very much at all, happily. So we're going to move on to another parts of law, which is going to be talking about how the Constitution, again, kind of breaks down and applies here in the laws portion. So we have protection against unreasonable search and seizure. What that means is that's your privacy. So people can't just access your personal health information again without a warrant. A judge cannot, or a police cannot just come in to the doctor's office and say, I want to see what was in this patient's medical record, or when did this patient come in for. Now, again, there are mandatory reporting, but outside of that, they cannot just go in and say, hey, give me this information because I'm the police. And that's not the case everywhere. So that is unique. So it's not unique. It should be obvious and a given, but it is one of the protections that we're given by the Constitution. Also, the 10th Amendment, excuse me, which says that anything that's not given to the federal government, the states can take care of it. So that what that does is it allows the states to implement lots of other public health policies and rules around how to govern things within their own state. And that's something you want to do because it becomes very important that the jurisdiction that's being covered, that you know who's in the jurisdiction. And that's why we often get more money and less interaction from the federal government. Then it moves down to the state level and then to the local, because your local government, your local health department should know more about the people within the local community than any other aspect. Okay. Also, police powers is what can be used to enforce or take away rights from people. This is something that also needs to be understood when dealing with public health law and dealing with public health policy. So states can pass laws, but they cannot do things that would be detrimental to the health of their citizens. And so we look at things like cigarette smoking laws or things like that line, or so that gives you the idea that you can pass laws to protect the health, but it can only go so far, right? Autonomy is big, and that's been making a bigger, I think, move across the board now. So yeah, you all are very quiet today. Actually, tell me that you all are active and talking. So I'm looking at the chat and not hearing anything. But if you all have questions, if you have comments, please let us know. Okay, so we're moving on a little bit more here. So what's the difference, right? We talk about laws. This is a law and an ethics course. And so, or of course, discussion. And so where do they differ, right? Because this is public health, and in real life, in the real world, when we're doing public health stuff, it's not always going to be an easy thing. We don't get to just walk out and turn off the pump and then everyone gets better. And if you all know the story, that's not actually how that went either. But we have to actually be able to implement these things and do so in a way that is ideally helping the community, not alienating the community from what we're doing. So that's a long way of saying laws in public health, again, is going to give you it's going to provide the authority, it's going to limit the powers. Again, whenever we're talking about laws within this or within anything, you should be thinking about what is given and what is taken away, because there's always going to be a kind of a push-pull there. And then ethics in public health is going to be really, what are we doing about those laws? So how are we implementing, how are we as public health practitioners, or even just how are we as people, right? How are we living? Are we living in an ethical way? Are we doing things the right way as they should be? I would like for you to maybe even think about um, the right. Uh, so if you can think of a situation where, and then, okay, let me back this up. Can you think of an ethical issue in your everyday work, right? So think about what you're doing. And again, this doesn't matter where you're at. If you're working in the health department, if you're working at the WIC office, if you're working at a hospital or a clinic, if you're working at NBPHE and you're sitting across from Ashley right now, right? Think of an ethical issue in your everyday work. And can you think of a situation where law provides authority to act, but it's not clear whether you can ethically intervene? So think about a time where in your everyday life at work, you want to do something, but you can't, right? An example of this that may be that I use a lot in the work that I do is someone needs to come to an appointment, and we usually have bus cards. This is Chicago. I'm in Chicago, by the way, if you all don't know. So we have CTA cards we give out, right? Transportation, or we can put them in an Uber sometimes. But it's only supposed to be used to and from appointments. And so if I have a patient coming in, I give them their card, they get on the bus to come, I give them a card to go back home, and they say, "Hey, Rich, can I possibly get another card? Because I got to go to work tomorrow to pick up my check, and I can't get on the train or I can't get on the bus unless I have a card, and this is the last one I got." Right? Then what do? So you have an ethical obligation because that card is for a very specific purpose. It's defined. The grant money says this card can only be used for this purpose. But what do you do then when you're having a push-pull, right? I want to take a second. I want you all to think about that and take a breath and relax. We've been moving a lot or sitting a lot as we're talking. And I want to take a look at some of the questions. Okay, good. Okay, good. I just need to say to have questions, and now y'all got them. Y'all got them. Good. Um, okay, so the Fourth and 10th Amendment. So let me back up before we move into this next aspect of ethics. That's good. If you do have other questions about the things that kind of were going on in the law portion, this is the time to ask that because we're going to move on. So let me get to these questions and then we'll get back to it. Okay, so Fourth and 10th Amendments. Okay, so outside of public health context, right? We're not in the CPH class right now, we're just helping our friends or kids or whoever with homework. Or we're watching the news and they're talking about a Fourth Amendment violation, right? Fourth Amendment rights. What that is talking about search and seizure. If a cop pulls your car over and they say, "Oh, I smell marijuana, I want to search your car." And if they don't smell marijuana, they can't search your car. And so that's the Fourth Amendment. So that illegal search also applies to things that are not just your personal property in your house or your car. It applies to your health records, right? So the things that me as a healthcare as a public health practitioner, I may write a note in an EHR. That is protected information, and the police just can't come and say, "Hey, give me that information." Or, and another idea is maybe the police they see someone on the side of the street that's bleeding or having an issue and take them to the hospital. They can't come in the next day and say, "Hey, what happened to that guy?" Right? Unless there was, again, a reason to have law enforcement involved. So, all right, I hope that was helpful. Oh, and then, excuse me, and then 10th Amendment. So this is, and maybe I said these too fast together, but this is so this is going to be a little different. I switch kind of gears here, but this is saying it's just in general anything that's not anything that the Constitution doesn't say that the federal government is in charge of, then the states can do it, right? Unless it's prohibited by the Constitution. So the Constitution lays out rules for the federal government. They can do this, they cannot do this, they can do this, they cannot do that. The Bill of Rights and everything, right? This is the last amendment in the Bill of Rights. So what it's saying is that the if the Constitution did not say President Joe Biden, you are allowed to do this, 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 and this, period. If that's not aligned, then that says that our governor, our state, the power to, for whatever the issue is, relies with them. So that's how we're able to do things like that. That's why we have Medicare. Well, it's not why we have Medicare, Medicaid, but it's why you have sometimes similar programs on different levels, because sometimes you can do more with it at the more local level. So I hope that's helpful. Let's see. So receiving and requesting medical records. Does this cover persons with mental health issues? That depends, right? So it's gonna generally no, because okay, so this is kind of an odd question. The answer is no, unless there's an exception. Nothing, no. But the way that it may be is if there is harm to an individual, or potential harm to someone else, then there are reasons on why a physician, and again, this has to be a physician's word, or in some cases, law enforcement can do this as well. They can involuntarily hold someone for a mental health issue, but that's going to be, again, it has to be documented, and I cannot comment necessarily on how valid it is when that happens, but that's the only way. But it cannot be giving out information, especially mental health information, without a valid reason for it, and again, and yeah, and without the proper laws being approved. So, yeah, okay. So we need to be able to identify differences in regulation between PHI and so that is actually a good question. Thank you, Caitlin. So Caitlin's asking, will we need to be able to identify differences in regulation between PHI, de-identified, and anonymized data for the section of the exam? And the answer is maybe, right? Probably. If I'm writing questions on this, I would write that, because there are a lot of good questions you can get out of that without it being seen as too complicated, and it's very important, right? So, but the way a question like that would say, I have in front of you is a document with a patient's height, birthday, address, and some other information. Is this something that can be released? And the answer is no, because it's identifiable information, right? Now, if that document said it had a unique identifier, excuse me, blood pressure results, and zip code, then that would be okay, because it's de-identified, right? So those are kind. You will need to be able to tell the difference between if something is, PHI or not, if something is like allowed or not based on what the information is. So okay. So for that question, Ashley popped on. So there's the reason I'm pausing is because it's like a bigger answer to that. Do you see what I'm talking about, Ashley, about the Caitlin's question? So do you want to take that? Or do you want me to?
Yeah,
Okay.
the question has to do with how up to date you need to be. So the question is, how up to date will I need to be in the current legislation and ethical discussions, e.g., overturn Roe, state level implications? So that goes into a little bit more into test development than Rich is going over today. And our exam gets updated roughly, we're always constantly looking at how items are performing, but we're also adding new items. We do a whole refresh every few years. So as far as updated items, we are not like immediately when something happens, we're not writing a bunch of new items and putting them into the test right away. So you should be aware of new things. However, with when the new content outline, new exam is announced, that's the kind of time that you would think, okay, we're doing a big refresh of the questions and everything that's on the exam. And that's something that we announce, we plan for, and it's you have some time to know what those changes are being, and then you can understand that the exam is being updated probably with the most current information at that time too.
And also as part, and I'm answering this is so in my other capacity, I also help as an exam writer and do some of the exam prep things. And so we also don't write questions that expire, right, for the most
Mhm.
part, or
Yeah.
that may time out. And so a question like we would not necessarily ask a question about Roe v. Wade. We may ask a question about abortion access generally, but that is still changing. So ideally, we probably wouldn't, honestly, since Roe v. Wade. So there may be questions about abortion, but it's going to be a generalized question, and it would be before like Roe. And so, and the way when questions are written, they get cycled into the exam little by little, as Ashley was saying, and they get tested before they're prompted, before you test on it. So I can say 99.9% sure there will be nothing on there about Roe v. Wade if you take it within the next little while. And even after that, it probably won't be. So, and as far as just the timeliness in general, again, we try not to write questions that have that may expire. And so we try not to do things like we don't write questions around COVID as much as we write questions around maybe a respiratory disease or an illness. Like we may write something around flu because flu's been around for a lot longer right now, has a lot more predictability to it. But we purposely would not write a question about COVID now because there's just so much, there's so much in it.
Yeah.
Yeah.
Yeah. And so, yeah, just like Rich said, it's not we're not trying to be topical. We're trying to go with the broader picture of what you should be learning. So I hope that, and I see that you wrote in the chat, it makes sense. So I'm glad that helped explain that.
And maybe since this is a shorter topic and this is the last day, if y'all have don't tell Ash, but if you have one or two of those kind of questions about exams, I might be able to answer a couple of them as well. If need be, as long as they're quick and concise. Okay, so let me get back to the chat, make sure I'm not missing anything else. Okay. Um, right, smoking indoors is a good example, Martina. And it's interesting, if you've traveled much, you'd be surprised in places that still allow smoking indoors. I don't know if it is anymore at this point, but there are still years ago, still places that still allow smoking indoors in certain restaurants and things. Okay, how today, school nurse. Yeah, okay, good. I think we're in a good place to move back on. Right. And so someone mentioned about being public board meetings, they have to be careful about what they think situations. So that's like an ethical thing, right? And I do want to address that. So let's get back to that. Wait. Okay. And so that's an important part, right? And that's where the ethics and stuff come in. And it's where you get to the point where you decide how to handle it. And the right answer here is that there's a regulation that covers how you should answer all these situations. But in real life, and on the exam, the way you want to think about this is what is the what is the legally best way to get the client what they need, right? So that's the way you kind of want to think about when you have those things where it's like giving a client a ride home, giving a client, or being careful what you say in a school board meeting or another type of board meeting because you have to be careful that those things don't come back on you. That's one of the hard things about being a public health professional is that you also have to understand your privilege and your power, that you're in a place of power to be able to say something. And so that voice may be important, right? And it's not as always as simple as yes, 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 or no, no, no. Sometimes you do need to take into account like the bigger picture. So And that's what this is about, right? That's really what a lot of this ethical aspects, and you've gone through the community involvement and all of that aspect. That's really what where these things kind of come in. Okay. Actually, someone's asking for the link to the book. Just FYI. Okay. Okay.
Oh yeah, is that Chrissy, are you talking about the study guide book? If you can just let me know, then I'll put the link to the study resources in that. Okay, yeah, I'll put that in there.
Okay, and then these last two questions, then we can move on. I will continue to answer, but these are coming up not an issue. All right, how these amendments relate to the international CPH exam candidates. So the way they, again, like I mentioned, the CPH exam, and as I'm sure Ashley and other people have mentioned, we try to write things that are not US centric. But the fact is some of the stuff is going to have to be a little US centric, and it's one of those things that just is. And what we tell you is we give you the resources to study for that. And the reason, what's important to know there, and I will just tell you this. I mean, these aren't questions, but I'll tell you the important thing to know about Amendment 4 is that you're protected from the government accessing your information without a really good reason, right? That's the idea. It's not the spirit of the law necessarily, but it's, that's that is the spirit of the law. It's supposed to be you're protected from people butting into your business. Um, and then for number 10 is just saying that if there's not a law that the federal government has instituted around an issue, then the state government can make a law on it. So the federal government hasn't touched something yet, the state government can. They can do so beforehand. That's it. Um, and then identifying differences between laws, regulations, and statutes. Yes, in the not in the sense of like, is HB 101 a law versus a statute? So not in that aspect, but just knowing what a law is, knowing what a regulation is, knowing what a statute is, knowing that, which branch they come from, and like where you may see a statute from, where you may see a regulation from, where you may see a law from, and how it may work appropriately there. Okay. So law doesn't. There's a question saying law doesn't invoke action at all. Um, no, because that's why people break laws. The laws have to be enforced, right? The law is there, and ideally, a person will obey by the law, or an organization will obey the law, and that's fine. And no action needs to be taking place. The action is abiding by the law. But what happens is you often have ways to enforce the law, or there may be things that are missing for the law to work. So again, think about things like um, a law around testing your animals, right? For maybe a disease, testing animals for a disease. But if the people that need to do the testing don't have the testing supplies and they can't do it, right? So someone will probably write a regulation, someone will do a grant to get the ability to say, okay, you're not a veterinarian, but as a farm owner, you are now allowed to like give your cow this medicine, right? That's kind of a loose example, but I hope that you kind of get the idea. The law is what it is, but then the regulation may be what actually helps enforce it, maybe. Okay. All right. Okay. So that's law. Ethics and public health. Ethics are going to, again, to provide analysis, deliberation, justification, public health action. What that's saying is it's gonna add the flavor to the decision, right? You're doing something that is um, public health based. It's a public, you're implementing a public health program. The ethics part is going to be how you do that in an ethical way. It's going to be how you do it in a way that is upstanding the greatest aspects of public health. Right, they haven't changed. They're about to change now. Okay. Um, and there's a question, and so this is more for you than for the exam, but also just get your minds thinking. Um, the difference in ethics and morality. So what is the difference there? Where are the thoughts of what's an ethical decision versus a moral decision, or are they the same? Right. Um, so can you think of a situation where it's not clear? So, and again, you don't need to think too much on this, but I just want you to think about this in your practice, that public health ethics will go about the way you do it, but you also still have to be a moral person. So you may not always agree with things that are going on with our jobs, and our it is up to us to understand that the health of the community is what we're here to do. Okay. So, all right. So ethics in medicine. Again, this is just kind of a note. Anytime I do any kind of talks on ethics, morals, values, I always bring these things up, right? These are things that we want not to happen. And this is just talking about um the bad things that have happened in public health, right? And I think that the ethical thing for us to do as public health professionals is to know the bad things that have been in our past, right? We can't erase those things. And we often benefit from the colonization of medicine because of a lot of the experiments that were going on, a lot of the racism and things that were happening in the process. And so now we want to make sure that we are not repeating those things, right? So never forgetting what happened before, and making sure that we're listening to our patients, we're listening to people in the community, and that we're make sure that we're having an ethical practice as we're going about public health, right? As we're going about this, we're disagreeing and agreeing with people, and we're convincing people to get vaccines, and they're arguing with us. We have to remember that there may be a reason why this person is anti-vaccine, or maybe they're only anti this vaccine. There may be a reason why, and understanding that is key to an ethical practice. Okay. That's my sub speech for the day. Okay. So when we dig into it a little bit more, ethics is going to complement the law. So that first part of the presentation we're talking about, this is what's going to complement that. We got all the information. We know that we have, laws come down from the federal government. State governments can make laws that are being implemented through grants and policies and everything. But when we do that, doing it in an ethical way, so ethics are going to complement what's happening within public health law. Um, we know a key part of public health is that we recognize, that everyone has a right to health and to basic human dignity, basic human rights. It's just a base of action. And this is something that I'm saying as a person, as a public health practitioner, but also this is like the law. This is the rule, not the law, but this is the rule. As a public health person, this is what we are supposed to ascribe to. And it is hard sometimes. We have to understand sometimes there is no right answer. And you just have to dig and dig and dig and dig and do what's best, right? Um, Thank you for those that are put some things in the chat for answering about uh morals versus or morals and ethics. Thank you for that. Okay. So the UN, United Nations, for those that may not know, the UN is a governing body across kind of the world that has several arms. One of the arms is WHO, but which is the World Health Organization. So we kind of have our little through path up there. But one of the key things that the UN is saying, they are also saying there are specific things that everyone has a right to, right? These are not things that are negotiable. Everyone should at the very least have this freedom. And I would even say freedom, justice, right? Those can be used in different things, different ways. Equality, I would probably say equity. Again, the point is that people are treated the way they're supposed to be treated. Um, Equal protection under the law, so that means we're not discriminating against anyone based on anything. And then you have, life, happiness, your ability to try to be your best, well-being. So having a standard of living that is good. Not saying that the UN doesn't say that everyone's going to be billionaires and millionaires, but it says nobody should be dirt poor. That's kind of the idea here, right? Um, and then APHA, American Public Health Association, their thought on ethics is that everyone has a right to public health. Again, you're hearing this over and over again because it's something that every organization says is super important, right? And then Public Health 2.0, we're talking more about social determinants of health, health and all policies. And the reason why this is important to the exam is because this is how we're going to implement some of those things. This is how some of the ways we're going to test you on ethics is going to be by asking you about things like social determinants of health, what to do in an ethical situation. It's hard for us, and not impossible. So you'll see questions like this, but it's hard for me to ask you a ethics test question that's not to a level that would be, easily answered by you, because we give you all the idea that this is, to be at a public health professional level, you're all going to be at least this much ethical, right? At least so ethical. So it's hard to write questions like that. So what we'll do is we'll write scenarios and we'll write questions around community-based things that we're looking for an ethical answer out of these. Okay, so it'd be kind of application-based. And social determinants of health, if you're not familiar with what that term is and what it means, and it's caused different things in different places. But it's going to be the conditions where you're at, right? It's how you live, where you work, where you play, where you pray, where you, go out on the weekend, where you go and you see your family. We want to make sure that all those things are safe and easy for you to do as much as possible, right? So it's saying that you should be able to go to school and come from school, have dinner, go to bed, wake up the next day, go to school, and you shouldn't have to worry about any of those meals. You shouldn't have to worry too much about like your safety while you're sleeping. That's the goal, right? And that is a social determinant of health. And for those people that don't have that access to that, then that is a health disparity. Uh, Good question. So there's a question saying, right to health is not the same as right to public health. I think I don't know. But I think it would depend on how you're defining health and public health there. Oftentimes, those are interchangeable. If you're saying health as in like physical, so again, in the public health community, CDC, WHO, they define health a certain way, like what's listed on the screen. Now, so yes, in that aspect, health, public health is all the same. But if you're talking about health as in an actual like wellness check or wellness kind of variable, then right, you may not have access to that. And what you may be asking, and this if so, this is an easy answer, is that you may have everyone has access to health care or to health, not necessarily really good care. Right, you hear that in law a lot, right? Everyone has access to a lawyer. It doesn't mean you have to be a good lawyer. So I don't know if that's what you're referring to. If so, then that yeah, that is the everyone should have access to adequate health, right? And I think it actually says that in one of the previous slides. Thought it did, maybe not. But the key thing, if it's not in here, it should be the key term there would be adequate health, right? So everyone has a right to adequate health. Um, okay, so social determinants. So we're going to go through a few more of these. Then we're going to get into the fun part of asking the questions, which is fun. Okay. So again, these are social determinants of health, and these are things you're going to know. You may have seen these before in one of the other presentations, but it's something that's going to hit a couple of different content areas because, it's a way for us to apply ethical practice of public health law. Okay. So some of the related concepts around that are going to be things like health disparities. So why is it that there's a difference in health outcomes for a Black male that is 35 and a white male that's 35 that have the exact same condition? Why are there differences? Why are there disparities there? What are some of the root causes of these things? So what's going on? What is going on literally up the stream that's causing people downstream to get sick? Right? What are some of those causes? Is it a familiar thing? Is it something in the environment? And then making sure that when we are doing things, we're using principles and we're using health strategies that actually help. So when you're doing an intervention and you are trying to help a community, or even if you're just collecting data and you're trying to help a community to get this data or whatnot, you want to make sure you're doing it in a way that is supportive and affirming. That means you're not talking about the subjects, you are processing the data in an appropriate, timely manner. You're not saying, oh, I don't care about this group of people, so I'll do this data later. No, if it's data that needs to get done, get it done, right? That is kind of equal. You go across the way. And you're also not doing things where you are going into communities and asking the community or going into a community and not asking them what they want and just providing something, right? So saying, "Oh, I'm going again. I live in Chicago, and I know there's a lot of people from Chicago in here. I saw early on, and one of the neighborhoods that we have that's a primarily Latin Day neighborhood is an area called La Vieta, and so." I can't go to La Vieta and say, "Oh, okay, I know there's a lot of people here that speak Spanish and that are from Central and South America, so I'm just gonna go and bring ooh, next Friday, I'm gonna go bring tacos to everybody in Little Village. And that won't work, right? And for those that don't know, it's because a lot of people in Little Village are Catholic, right? That's how they're raised. So they don't eat tacos on Friday. They eat fish, right? And so you have to have that knowledge base, and you have to be able to learn and talk to the community to say that I'm going to give you this intervention, I want to help you. I'm going to do it in a way that's helpful for you, not something that's going to hinder you more. So, and that's what egalitarianism is. Okay, so we're just about done here. We're going to play a little, not a game, but we're going to talk a little bit about kind of applying these things, applying ethics and applying uh, law. So recently there was a big outbreak of a disease called Mpox. It used to be called monkeypox. We went through some naming conventions. Point is, it is a disease that is not a sexually transmitted infection, but was being spread sexually mostly, or was being spread by people that were also having sex, right, through intimate encounters, and it was mostly happening in communities of men who have sex with men. And so, the recap, Mpox, and this is real, right? So this is something that actually has happened. So last year there was a big outbreak of Mpox affecting mostly men who have sex with men. And so, what do we think about an intervention to get people vaccinated for Mpox? How do we figure out who's who? How do we figure out when? How do we figure out what, if we have a vaccine, how to use it, how to distribute it, who's being affected now, who's going to be affected later? And the way you decide those things, just like we did with the COVID vaccine, is say, oh, this community gets this many, this community is at higher risk. But then do we have to think out and say, well, right now, this is the community that's being mostly affected, but we know that over time it's going to trickle into other communities. And so can we get ahead of it and start, you know, getting things there as well? And so that's a real world application for something. So when you're thinking about ethics and law around Mpox, you can think about, right, if I am introducing this intervention to get everyone vaccinated so that no one spreads Mpox anymore, what laws do I have to abide by, right? Can I give an Mpox shot to someone that's under 12 or under 16? Can I do it on school grounds? Can I do it at the library? Can I do it to people that are undocumented, right? Those are all issues around the public health law. The other aspect of it is the ethics. So who is it? If someone is trying to jump the line, but they're here, right? Is it ethical for me to still give it to them? How much vaccine do I have? Do I know I have enough? Is there a surplus? If someone calls say they weren't coming, right? These are things that you have to think about how to implement. And so with that, there's not again, and there also won't be a question about Mpox on your exam. So maybe something about smallpox from a long time ago, but not Mpox. But I do want you to just have that thought. When I leave these classes, I want to make sure that you have more than just the prep for the exam, because that part you've been doing your studying, you're in these classes, you got it. I have faith in you, you're gonna be a CPA soon. But I want to make sure that beyond that, you also get something out of these to take forward into your practice and to share with everyone. And so I hope this was good. This is a topic that people either know way too much about and they yell at me because I said something wrong, or they don't know very much about it, and they're just like, I don't know what just happened. So the best way to get through some of that is we'll definitely give you a chance to ask some more questions, and we're going to do some practice. Look, and we're going to do some practice questions. And so I'm going to stop sharing, Ashley. Right? Yeah. Okay. Perfect.
I'm sorry, I'm muted, guys. So with the practice questions, we'll put up the polls like we have before. I'll leave them open. And then, Rich, if you can go over the answer with them, the poll doesn't tell us the answer. And so if you could just go through the answer and tell them the answer and why.
Okay.
Okay, all right.
And if we get through all the polls and there's some more questions and answers, I do have a whole bunch more. But I think we might be all right since this is the last one.
You gave me 18, so I think we'll be good.
Okay.
You guys, and that'll give you a good idea of what kind of questions will be in this section as we have with the last few. So, okay, all right, first one. Give you a minute to answer. Okay, about 10 more seconds. All right, so this one, I'm going to display on my screen the slides. So give me a second because I have the ones you shared with me. Okay, so do you all see the slides? Yeah, okay, good. All right, so for this one, it looks like we had 46% said Nazi human experimentation, and then the other largest one was D, Tuskegee syphilis study. So Rich, it looks like our answer was A.
Yes, and the main reason why it's A in this one is because it is 1947. The ski syphilis study went on all the way up into the 80s. But that's a good second answer. And I know you all have heard this 10 times. I'm gonna say it anyway. You see the four answers, cut them in half, which two you think it might be, then think about the two and use some of the context clues. If you don't just know the answer, which you should, but if you don't, right, or maybe you shouldn't yet, but you will when it comes to the test time. But then you look, okay, Nazi experimentation, Tuskegee syphilis study, when were they? And okay, Nazi was in the 40s, and then Tuskegee kept going sadly on into the 80s. So there you go.
Yeah, and good thing Jody in the chat just put Tuskegee was only affecting the US, and this says international too. So that's another key.
Ooh, yep.
Yeah, good
Well,
one.
right. Yeah, good call, good call.
Okay, so let's go to the next one. Okay, question 2. Mm-hmm. 15 more seconds. Okay. All right. So this one, it looks like D was the largest. 88% said D. So it's a correct answer.
Good.
All right, ready to move to the next one?
Mhm.
Okay, this one's a long one. Still going to leave this one open for about another minute. It looks like we have quite a few people still reading. Okay, about 10 more seconds. All right, so this one looks like 57% said A.
All right, right. So the answer was A. Oh, as you can see there. Um, so what they did was they made sure everything else was standardized and they only using gender and race. And so when you're looking at the results, you want to make sure that that's what's being done differently. Um, as I'm reading this one again, I do want to say two things. One, questions will not typically be this long on the exam. This is, again, an older question that was cycled off the exam for that specific reason. Also, this could be in across two different domains as well. So this one was a harder one. So if you didn't get it right, that's okay. It was a significantly harder question than, again, that's why it was cycled off. But good job for those that whittled it down.
Yeah. All right, let's go to the next one. All right, I'm going to give you about 15 more seconds. Okay. This one looks like we've got quite a bit of differences. I think you can see here on the, it's got roughly 30% for A, B, and C, and then about 11% for adequacy.
Great. So this is going to be a question more like what you're going to see. This is what we try to write where the words seem similar. This is when we just have to know the answer. It's a recall question. And his acceptability is what, pardon me, excuse me. The institutionalization of the values is most likely to influence which of the following aspects of care. It's going to be acceptability, because what it's doing is having culturally appropriate care, which is going to um, help acceptability. So it wouldn't be adequacy because adequacy wouldn't fit, right? The changes that's being made. Accountability wouldn't be because this isn't like an IG or an internal affairs type of thing. Accessibility is an issue because it's not about getting someone in or out or having like building an extra ramp or widening elevators. That's accessibility. Acceptability is the ability for people to get in, be acceptable in care, and move on. So that's what the difference is there.
So I'm sorry.
No, it's part of ethics. This is so part of the ethics things you're going to be doing is going to be some things that are going on, like some social determinants of health, some equity, some community-based practice. A lot of those things are going to be tied into law and ethics as well. Right. Moses says acceptable values and norms. Exactly. And that was a harder one because they all look the same, and you're like, wait, what's what? So you really do have to know what to do there. And in that case, again, I would go through, okay, what does each one mean and which one fits? Oh no, this is a very specific yeah, there are more specific definitions in the book. Yes. Well, I don't know for this question specifically, but if you look at the what we can do is there'll be resources that we give you that are attached to questions and answers. So we can show you the source that this actually came from. Any question we write, we actually have a source attached to it. So it wouldn't be in the book you all have now because this isn't all from your book. These are retired questions. So
You ready
right,
to move?
accessibility is ramps for disabled. Yep, perfect.
All right. Question 5. Okay. I'll give you 10 more seconds. Okay. So this one, it looks like 84% said D.
Good.
And D. Answer.
Good. Yep. And again, this is again part of going back to kind of the ethical thing of like what do you do next? How do you hit the community base there? So remember I said we're not gonna ask you a lot of questions about like an ethical law or an ethical, quote. It's gonna be about application. Okay.
Okay. 10 more seconds. Okay. All right, so it looks like the majority said regulations with 53%. No one said treaties. And then statutes came in with 35% and common law 13%. So it is statutes.
All right. And the reason for this one is, so again, treaties are going to be between different like parties, so it's not appropriate here. Common law wouldn't be because not every state is a common law state. And plus it's a federal aspect. What it's saying here is which sorts of US law gives power to health departments, and since it's a law, it's not a regulation, right? Because regulation is done by the executive branch to implement and carry out laws. Statute is the actual what gives the power away. So that's why it's statute. Now that was again a hard one. And the reason why you would know that is because of the keywords there being US law as opposed to what a regulation would be. If it was something along the lines of, yeah, it could be. I mean, it would be worded differently, but yeah, if you're talking about what organization enforces, food security, then yes, that could be, or a statute gives them, right. It would be something along those lines. Don't make me write questions live. I'm not good at that, but yeah, it's something along those lines.
All right, let's go to the next one. All right, 5 more seconds. Okay. So this one looks like 61% said B, and then we have 14% said A, 20% said D, and 6% said B, C. Oops, I'm sorry. So 7. It looks like B is the correct answer.
Um, yeah, I don't know. I mean, I think that hopefully once people see that, I don't know how to explain that any better. Individual liberty is just, so this is one of the things again, it's when you look at the different ethical principles that are laid out in our guidelines, and when like you'll see that it's not feedback from the community because it is a voluntary evacuation plan, so you're not doing that yet, right? You're not getting feedback. Um, Timely manner just doesn't really fit as well. I see how people can maybe think that if we're talking about an evacuation plan, but that's not going to get into the actual principle of an ethical thing, right? When it's protection of individual liberty, that's an ethical thing. That's an ethical like conundrum, right? So that's what we're going into there. Right. Good idea, Jody. See? So Jody said they were using a keyword matching to figure it out. Sometimes it's what it works. You get it, you narrow it down, then find that last piece. But I don't think I have anything to add on that.
All right, next question. This one's a long one, so I'm going to leave it open for a couple minutes. All right, I'm gonna leave it open for 10 more seconds. Okay. This one was a lot of reading. So it looks like we have 53% said B. And then we've got 25% said D, 17% said C, and 5% said A. So the correct answer is, oh, I'm sorry, is B. So good job, 53% of you.
Right. So another one that was you had to really think it through. And again, another one that's a lot longer and we would like to put now. But really for this, you can concentrate on kind of the last two sentences. Specifically in the last one it says, which public health ethical principles are in conflict, right? So we're looking at the rights of the individual community members to be able to, excuse me, you know, decide on their kids going to school or not versus the cause of the disease. So, um, you know, so that's what we're looking at here. It's about the conundrum between the two. And again, legal, so it's not a legal issue. So that's when you use public health to help enforce the issue and make the right decision. But and again, for those that have other answers, it makes sense. I see why I see your thinking about acting on it fastly, but it's not so much about that. It really is about the choice what's going on here. And then right, respecting the values, beliefs, and coaches in the community. Um, but it's not about the social environment, it's more about the disease. And so that's the difference there.
All right, this one. Another long one. So look, give me a second. I'll share the poll. Richie really made him read.
Yeah, I didn't think about the polling on this. My apologies.
No problem. All right, about 10 more seconds. Okay. So it looks like most of the answers were two responses. Got 55% said B and 43% said A. And then we've got just 2% with D. So the answer is
So this is one I wish we could talk about in person. So the answer is I'm sorry, number two, and the reason or B, the reason it's B is because when, and this is something again you may not know if you haven't done this kind of work before, but it's in this, it's in the instructions. When you are doing a research study and then you find a better intervention, you have to start doing that intervention. You don't continue to follow someone, exactly. You don't continue to follow someone after you know that they can be healed or cured or whatnot, right? And so you can keep your study going by implementing the drug and then like watching how it reacts after that, but you have to implement it. And it's actually been a really great thing that's happened in the past where we've been able to stop studies ahead of time because we see how effective it is and we can actually start using the medicine because it's that effective. So it is B. Whenever you have the option to give someone a better medication, you should give them the better medication.
All right. So next one.
All right, and I'll answer your question in a second, Caitlin. Let's see.
Let's leave it open for 5 more seconds. Okay. So it looks like C, 77% said C, but it looks like the answer is D.
All right, let's read them. So the correlation between social status and health in economically developed countries is most likely explained by which of the following. So healthcare financing and quality of services provided. The thing in this question is in here for this specific reason because people often think that the more money you spend on health, the better off you are, and we know that's not the case. So that's why people are answering C. You're answering what people often say. The reason is D is because the low socioeconomic status is what's gonna. It's like the upstream downstream effects, right? The sorry, the stressors and the anxiety and just the matters of living in like a low economic status is what's gonna cause more issues because core that stress becomes physical and that's when comes into more issues and that's why you're having social status and lower health in those economically developed underdeveloped places. So that's why. But again, the key thing here was about the US, we spent about 3%, and that's it. And that's the big thing, that 3% number. So it's not correlated to how much you spend to actual health outcomes. Because so the key here is that other countries spend um, a lot less on their health care than we do, and they have much better outcomes. That's the point. So it's not about how much you spend on healthcare, it's about the quality of the care. Yeah.
Yeah. Did you want to keep going with the questions?
Oh, you hear them. Yeah, that one was tricky. So let's do two more. Skip number one, and let's do the next two, and we'll just see
Okay,
how we're at.
good. All right, and then let me share.
And again, right? So someone's like, "Oh, this one isn't," it's unclear, and that's why they're not there anymore, right? These are things that we saw. So another aspect of this, and again, if you all have heard this already, I'm sorry, but another aspect of this is what happens is after several iterations of the test they NBPHE looks at this and says, okay, people miss this a lot, right? So maybe there's something wrong with that question, or maybe certain groups miss this, or there may be something wrong with that question. So they often cycle questions out for that. Low performing, they call them like low performing. And I'm giving y'all this, don't tell Ashley I'm telling y'all this. but like low performing questions do get booted out because we may say it makes sense. I'm an expert. That makes a lot of sense. But if the populace, the public health populace doesn't get it, then it's not a good question. Right. So yeah. So often of these are not great questions, but it is going to be something similar to what you may see on the exam. And it's to get you thinking through the processes. So thank you for bearing with us. Okay, go ahead.
Yeah, and we are writing new practice questions, so we're working on it right now.
Right. It is hard to write these questions. So writing practice ones is hard too.
Yeah. And once you all are CPH certified, you can volunteer to help with that.
Yes, please do.
I'm going to keep leaving this one open. I know we were talking, so I know not everyone has had a chance to read through this. So and we'll leave this one open for about 10 more seconds. Okay. So it looks like we say 59% said C.
Good. Good. And so you can go ahead and go to the next slide. I don't know. Do you have the next slide on them or no?
Yeah, no, goes through this.
Yeah, so that's it. So it's C, ensure compliance with constitutional requirements. This actually gives you the reason. So this is one that we didn't go over in the slideshow, but it's something I asked to actually do a couple of these next ones because these are things that even we can't go through everything on the exam in the slideshow, but these are things that you're going to want to know. Right. We talked about federal law and how public health law is involved in that. So you need to know like what a federal administrative law judge does. And again, this is something that you have probably never heard the term before until today, and that's okay because now you know to go look up what type of judges there are, and you'll know what to do when the question comes. So, but yeah, the answer is to ensure compliance with constitutional requirements
Okay.
of due process. Okay.
And then you have some references too.
Yep.
Okay. All right, next one. Here's the question. All right, 10 more seconds. Okay. So it looks like we have 71% said C, and then we got 14 D, or sorry, B, 9A, and then 6% said D.
All right, this is it. Autonomy of the individual. That's really what this is all about. This whole lesson today, this whole section was about public health law and how do we make it to where it's not being too paternalistic on the individual, and the individual continues to have their autonomy. And it's that push-pull, which is why we have the laws and why we need ethics to help guide us in making those hard decisions. So I think this is actually a good place to stop. I think this is a good answer, good question to end on. So again, key takeaways. Jody said in chat, every question is going to be perfect. I will say that I think I am very confident in the questions being really good now. It's been a while, right? It's been a while. These questions are old. The questions are really good now. And the thing is, you'll know what bad questions look like, so you know what good questions look like. Um, but I think these are good. The key is to, like, if everything I said sounded completely foreign, then just go relook at those sections, and then you'll hear it this time, and you'll be like, oh, now I get it, right? So just look at the sections where you were like, I either never heard that or that's not what I thought, and then it'll come back in. It'll refresh now that you've heard it.
Okay. All right. So do we have any more questions for Rich about law and ethics today?
My pleasure. It's been great with you all. Thank you.
Oh, Christine, your question, how long does it take for the study guide to come in the mail? I would ask them directly because it depends on what they have going on. So I would check with them directly when you order it. Okay, so if there are no other questions, I just wanted to say this is our last presentation. It's been great getting to know so many of you. I am so excited about you studying for the CPH, and I hope to hear from many of you once you pass that you have passed the exam. I also hope that these review sessions were very useful, that you know where you need to study, where your strengths and weaknesses are, and that you just feel more prepared and ready to take the CPH exam. The one last thing I was going to say is I am going to be sending out an email today. It'll have a link in it that has a feedback survey. So if you could fill that, take a little bit of time, fill that out. That helps me understand what you liked about the sessions and what we can improve for the future. And I also will include in that link the link to the past sessions, so you have that for your continued studying. And like I said, I'm very excited to hear from many of you once you do pass the CPH. And it's been a great time getting to know many of you virtually over the last 5 weeks. So thank you.